Text, Dr. Brooke Staley, EIS 2023, What's Art Got to Do with It? April 23, 2025. Logo, CDC in a photo, a young girl smiles next to a middle-aged woman.
This is 5-year-old me, cheesing next to my Nana after my first ballet recital. I grew up watching my mom, who's actually here today, watching her star in musicals, and knowing that my aunts performed on TV and Broadway, and in churches all over the place, and that my grandma Evie could transform fabric into beautiful designs.
Photos depict theater performances and family members.
For me, art was life, and also the family business. But as much as I loved the creativity around me, I found myself drawn to something else. Now, my mom kind of thought I was going to become a lawyer or a journalist, and honestly, she might still be holding out hope. But instead, I think I surprised us both and committed my life to science.
An image of the brain is colored on the right side. Below it reads the text, Neuroscience.
When I got to college, I found my way to neuroscience. A blessing because it's inherently interdisciplinary. A field that taught me to flex me to the left brain, right brain model. A concept that I found initially fascinating from a scientific. So the discipline of the neuroscience lab. Mice, monkeys, petri dishes. Oh no. Remember, oh, okay, you guys, no problem. Can you guys hear me now? All right. I remember studying the neuronal activity of the giant squid. A fascinating but very removed experience. Honestly, maybe it's the Scorpio in me, but I am drawn to the complex and messy world. And I didn't just want to understand science, I wanted to use it to help people. So, enter epidemiology.
Icons surround the term epidemiology with the labels, public health, population, analysis, laboratory, treatment, disease, statistics, social science, data collection, environment, infectious disease, hygiene, assessment, vaccine, clinical trials, pandemic, research, people, disease prevention.
Now, epidemiology is often thought of as solely a left-brained field. Data-driven, analytical, and evidence-based. But is it really? What if epidemiology is also right-brained, rooted in creativity, intuition, and human connection? And what if that right brain part of epidemiology is actually our superpower? So, now I'm going to ask you guys to go back to school with me, but don't worry, there's not going to be a pop quiz. I want you to think back to your first stats class or some first year science course. The rules were clear. If this was an epidemiology or biostats 101 course, you might have learned how to structure a case definition, how to interpret a p-value, how to calculate a confidence interval. There was comfort in the clarity that if you followed the method, you would always get the right answer. It was straightforward, left brain work.
In a split screen, an image of cattle farmers appears beside pedestrians in a major city.
But the longer you stay in public health and epidemiology, the more complicated things get. The communities we serve, they don't live in controlled environments. Problems don't always fit neatly into case definitions, and the best approach isn't the one with the significant p-value. It's the one that actually works for the people you're trying to help.
Text, objectivity versus subjectivity.
And here's the thing. Early on, we're also taught to stay objective. Remove the bias, keep a professional distance, and follow the data. But real life doesn't work that way. Communities aren't data points, they're people, and people bring nuance, context, and unpredictability. So that's where the artistry comes in. The way we engage with communities, the way we adjust our approach in real time, that's not in the textbooks. That's the part we create for ourselves.
Images depict a news headline about salmonella, a photo of a forest fire, and a microscopic image of a cellular organism.
And EIS is a perfect example of this artistry in action. Some officers investigate foodborne outbreaks, others respond to environmental exposures or infectious disease threats, and when we're deployed on an EPIAD, like y'all just talked about, we leave our primary work behind and adapt to an entirely new challenge, bring our own signature approach to the work. Because public health isn't one size fits all, we have to figure out what works, and that requires both science and creativity. So, now I've told you about my love for the arts, but that extends to the culinary arts too. If someone was to peek at my TV algorithm, they'd see a whole lot of true crime. Messy Scorpio enters from stage right, and cooking shows.
3 TV show posters appear for Top Chef, Next Level Chef, and Master Chef.
And honestly, public health sometimes feels like one of those cooking competition shows where you are handed a box of random, sometimes questionable ingredients and have to make something great out of it.
Images show cheese whiz, beef liver, and Swiss chard.
So here is Melissa Danielson, a mentor of mine, a brilliant statistician, and a health scientist. Also a fellow foodie, and a master at making something out of nothing when it comes to health data. So in recent years, our team in the Child Development and Disability branch was facing a real gap. We had almost no public health data on adults with ADHD. Clinicians and advocates had been sounding the alarm for years. Adults were struggling to get diagnosed and treated, but we didn't have the national data to support their stories. So Melissa did what great chefs and great scientists do. She opened the fridge, saw what we had, healthcare claims data, a meaty but sometimes messy ingredient, and figured out how to make it work. That analysis gave us a new lens. It showed who was providing care to millions of adults with ADHD. It gave shape to a problem that had gone unmeasured for far too long. And when the opportunity came to collect new prevalence data on adults with ADHD, thanks to Melissa and others on my team, they trusted me and handed me the apron. Melissa passed away last June while we were working on that paper, but her influence is all over it. And when we released the research, we didn't just publish the numbers. We paired them with lived experience stories. Clinicians shared the clinical view, and adults with ADHD shared how it shaped their lives. And in doing so, we were able to elevate a story that had long been overlooked and amplify it in the voices of those who are living it. Because the data gave us the facts, but the stories gave them power. And here's another reason why this matters.
A woman holds a protest poster that reads, "Science has your back."
In today's climate, data and science don't always resonate the way they should. If we don't tell the story of our science clearly and carefully, someone else will. And the way it's framed might not be the way it was intended. Because the truth is, stories last. Okay, now pop quiz. Just kidding, I promise I wouldn't do that. But seriously, if I asked you to name the most cited MMWR of the past decade, what comes to mind? Now, I think I see some of you pulling out your phones now, and that's not the point, because most of us will have to look that up. As important as the scientific papers are, and they really are important, they don't always stick. But now if I ask you to picture the Mona Lisa, you can see it almost instantly without me pulling it up on the screen. Not because it's the most detailed or even the most correct piece of art, but because it's memorable. It endures, it tells a story, and makes you feel something. But part of the reason why it endures is because we were taught to remember it. For many of us, we first encounter it in a textbook or on a t-shirt far from its original context. The Mona Lisa didn't just last, it was curated into history, reproduced, promoted, and preserved. Now, for some of us, the memorable works of art of ours don't exist in the Louvre. Maybe they're a Basquiat or a Frida Kahlo. But the point is that art, like science, can reflect power, who creates it, who frames it, and who gets remembered. Now, another element of art is the technique, and I know for the epidemiologists in the room, we all love our technique as well.
An image shows code on a computer screen.
We nerd out over clean code, predictive models, a regression that runs on the first try without throwing an error, thank you. But the most powerful work resonates whether or not you understand the technique, because the best art transcends its tools. Technique isn't the point, it's just the path, and the point isn't the syntax, it's the story. And if we want our science to stick, to mean something, we have to bring it back to the heart of the matter. So when I started this talk, I started with a story about my family and this discipline that many of us hold dear. I've tried to convince you that we are both scientists and artists, and to see the power of the lived experience. But there was missing data from the story.
The photo of Dr. Brooke Staley and her Nana appears.
After that ballet recital, I remember Nana dealing with cancer. And I remember feeling helpless, partly because I was a little girl. But as I grew up, I watched other members of my family face their own health struggles. And then I started seeing patterns, health challenges that weren't just personal, but shared across my community, which at that time was Oakland, California. And when I went away to a suburban boarding school, I saw a stark contrast. Health struggles were still there, but they were different. So in Oakland, a diverse working class city, health challenges were urgent and visible. Asthma, community violence, addiction, inadequate access to care.
A photo appears with the Southborough townhouse.
In Southborough, a small affluent town, the issues were quieter: anxiety, disordered eating, private struggles behind closed doors. These differences weren't just random, though. They reflected the context of people, the context people were living in, the environments, the resources, the systems. And it's this idea that haunts me, reminding me that even the de-identified data represent real people in real context.
A map of words surround the term poverty.
And those contexts sometimes include injustice, bias, and the other nefarious impacts of countless isms, all of which can systematically chip away at people's agency and power. And this is even more important now, as the language we use, the way we frame our stories, is increasingly under scrutiny. So, to those outside of public health, wave your hands. I think there's some people in here. Awesome. Your stories matter more than you know. When you share them with us, just as importantly, be mindful of the stories you share on our behalf. Because we need truth, care, and trust to spread even faster. And to my people, the epidemiologists, the public health practitioners, great, all right. And to my people, the epidemiologists, the public health practitioners, the ones behind the data, our job isn't just to analyze. It's to listen, to to tell the story right and tell it well. Because that's how we build connection. That's how we build trust. That's how we build something that lasts. Data aren't just data. They represent real people, real communities, and real lives.
An illustration depicts a woman holding a paint palette and brush while data and graphs flow out of her hair behind her.
And that's why public health can't just be science. It has to be art. Thank you.
Text, Dr. Brooke Staley, EIS 2023, What's Art Got to Do with It? April 23, 2025. Logo, CDC.